This is television for the Isles of Scilly, brought to you with Worldwide Financial Planning, Truro and Penwith College, and the Scilly Lottery. From Radio Scilly, this is scillytv.com. There's concern amongst some members of the community over how the Town Hall is spending cash given by the Department of Health to deal with stroke care. In February 2009, councillors voted to apportion the £75,000 a year under the stroke care grant to a number of projects over 3 years of the grant. In the first year, £30,000 was set aside for a lift for Park House. But £35,000 of that £75,000 grant was, according to the plan, spent on director salaries, consultants or review work. Now it's understood that around £30,000 has gone to the Normandy swimming pool and funding from the stroke care grant has gone to the Darla Ride scheme. We spoke to 3 councillors who told Radio Scilly they've received complaints or concerns from the public over the decisions made which some islanders feel don't directly benefit people with stroke. Carol Clark from the Islands Link organisation says it's an issue they've taken up.
Sue Williams, in her regular meetings with Penny Penn Howard, we have been talking about that grant allocation and where it was spent. Most of it went on capital expenditure on facilities that the council felt would benefit people with a disability and people with a disability following stroke. And I know there is some concern in the community over how those decisions were taken.
Carol says some money has gone to people who may be viewed by the community as more obvious recipients of this specialist grant. Scilly TV and Radio Scilly try to get a council comment, but key personnel are on holiday. We'll bring you an official statement if one is received. William Thomas of the Town Hall led a delegation of islanders to have a look around care facilities for people with stroke and emergency facilities at Treliske. He says they're keen to hear about islanders' experiences.
What we intend to do now is to look at the aftercare. What happens to people after they have suffered a stroke and they've been given their treatment package and come back to the islands? What level of care do they receive here? What is actually required for that care, and how it is delivered? So what we want to try and do is to identify good practice, what's best practice, and certainly within the island community there may well be areas which we can look at to expand on, such as the telecare medicine monitoring package. We also want to identify if there are any gaps, to see if there's any improvements which can be made. And so what we would like to do is to invite anyone who has suffered a stroke or a TIA within the last 2 years, if they would like to come forward, so that we can interview them and gain from their experience. Perhaps if they wouldn't like to do that, their carers could come forward, because that's a very important integral part of their care, that whoever's looking after them, to support them. So we would like to invite anybody to come and share their experiences with us to help us in this project. Again, as I said, really we want to try and see if we can improve, if necessary, the aftercare which is already provided, or indeed learn from their experience that we can share with others, particularly the Care Quality Commission.